Saturday morning, the Experts program kicks off, and that means Luis Alvarez, CEO of the Alvarez Technology Group, is back with us once again. Luis, welcome back. And by the way, we are just 7 days away from Christmas. So are you Santa Luis this year?
I am Santa Luis. You should see all this. We started shopping early for our granddaughter because we were concerned about the supply chain issues. And fortunately, we haven't had any problems getting the stuff that we have. But now we have a bunch of boxes under the Christmas tree. I'm excited. It's getting to be almost real.
Hey, so grandma and grandpa can't spoil their grandbaby enough, right?
Exactly. You only have them for a little bit, so you might as well take advantage of it while you got her.
Hey, we have an interesting story to kick off the discussion with today, and it's about AI, artificial intelligence in healthcare. Where is it right now? What's coming next? And what's further down the line? First off, how is it used in our healthcare currently?
Well, it's used very extensively. You'd be surprised. I've been doing some research on this for an article that I'm writing, and AI is pretty much present in everything that the medical profession does. Everything from doing the documentation and into the medical records to helping doctors diagnose things to even performing surgeries. My neighbor, unfortunately, got diagnosed with throat cancer a few months ago. And when he went in for his treatments, which consisted of 6 weeks of radiation treatments, that radiation treatment wasn't administered by a doctor. It was done by a robot using AI that was able to detect where the nodules were and what the proper course of treatment was based on the size of the nodules. So the doctor didn't really do anything other than sit back and push a button to get the thing started. But we're starting to see AI become a bigger and bigger part of every aspect of healthcare, including diagnoses. Radiologists now are relying quite a bit on computers and machine learning to help them do a better job of reading and interpreting x-rays and other type of medical soundings. And we're starting to see it in the homes. In particular, there are robots that are being deployed as a way to help take care of older people who may not have any other healthcare providers available to them. These robots that are sometimes cute little mechanical dogs or cats really serve an important purpose, helping keep an eye on those folks and making sure that if they fall, that it can call 911 or call emergency services to come help them, making sure that they take their pills, making sure that they don't wander off if they suffer from dementia or Alzheimer's. So their AI and robots are becoming a big part of healthcare.
So is this going to be a way of kind of trying to hold down the cost of healthcare? Because the cost of healthcare generally, like the cost of a college education, rises much faster than the general rate of inflation.
It's going to become a critical component for controlling the cost of healthcare, but also there's expected to be a shortage of doctors, up to 100,000 doctors in the United States that will have a shortage of by the end of this decade. And the way you make up for that is to introduce these technology solutions that can let the doctors focus on the higher value things and use AI and robots and other machine learning to really handle the blocking and tackling of healthcare, lowering the cost in the process.
So where do we see this going? Like, what we're talking about what's going on right now, but is there any big game changer that they're looking at as a future kind of thing for this?
Yeah, well, one of the things that they're trying to do is focus on trying to keep people from having to go into a doctor's office. We learned that during the pandemic, that you can effectively diagnose and treat people using telemedicine and other remote technologies so that people are less likely to get sick by going into a hospital or into a waiting room full of other sick people, which is the thing I hate to do the most when I have to go to the doctor. So the idea of using these virtual assistants where you as somebody that needs healthcare, you can just simply call up an app on your phone, put in your symptoms. Maybe it'll take your temperature, it'll take your pulse, it'll take your blood pressure, and then you can get a diagnosis and have prescriptions delivered to your house automatically instead of having to go out to the pharmacy to pick them up. That's kind of where healthcare is going to go. And you're going to see more and more diagnostic type of equipment being deployed in the home. I mean, we already can pick up, like I said, our own blood pressure machines, and we use our watches to take our pulse and take our temperature all the time. So those things are all going to be integrated in a way that will allow us to be more efficient in detecting problems and dealing with those.
Well, I note that a lot of medical groups now are doing video visits. That started during the pandemic, and you would be told that, unless they were going to draw blood from you or they had to give you a shot or something like that, you were going to talk to your doctor over a Zoom call. And so that's become something that's more prevalent now than before. And I can see where that can be, like you say, you don't have to go into the office and sit around a bunch of sick people. But then at the same time, I think the doctors would agree, Luis, that there's no substitute for seeing a person in person and being able to, if you're the doctor, look at their body and see what's possibly going on with them, something you might not notice if you're talking to them them on a video link.
And I don't think doctors are going to go away, but it'd be nice if they were able to focus more on those higher end visits, right? The things that, okay, listen, we really need to get you in this office and see you in person, rather than slice and dice 5-minute appointments with 30 or 40 patients a day just to do the same thing that you could do with an app on your phone.
And then one thing I do note that they can do on the doctor's end of things is the offices can be better, like when they're using the MyChart technology, which has become really a big way of communicating with patients, that if you need to have blood work done, well, that should be in your MyChart. Mm-hmm. Instead of you having to go to the doctor's office and have them print out or do the blood work right there, they should be able to send you that information through MyChart that says, hey, we want to get some blood work done for you before your visit, so here are the orders, right? And then you can take them to your lab, whether it's LabQuest, whomever you go to, present that to them, and then they can do the work for you, rather than having to, say, if you're in Monterey and your doctor's in Salinas, you got to drive all the way to Salinas and ask them to print out the doctor's order for the lab work they want done, and then you grab it and you take it and you go somewhere and get it done. It would make a lot more sense to have those orders available to you through the MyChart, and then also on the MyChart when you have an appointment, rather than just giving you the option of, would you like to visit with the doctor on a video appointment or do you want to come into the office? Why not something explanatory as, here's why you have an appointment. This is what the doctor wants to talk to you about today. That better allows the patient to make a more intelligent decision as to, do I want to do this over video or do I want to go in person to the office? There's some things that they can exploit with the current technology that they're not doing, that is more so kind of the people in the office, they need to have a meeting and get on the same page together and maybe talk to the patients about what would be helpful, if you see what I mean.
Yep, absolutely. And I think that's the direction we're going to go. All of this stuff, we like self-service. We like those kiosks that let us, take more control of our lives. And I think we're going to do the same thing with healthcare.
Luis Alvarez, CEO of the Alvarez Technology Group, has been our guest online. It's alvareztg.com, @AlvarezTG. That's their Twitter handle. And Luis, the toll-free number for the I-Team.
Give us a call at 866-78-I-Team. That's 866-784-8326.